So once more, very good morning to all my dear students, and I welcome you all into the industrial pharmacy first. So, dear student, today we are on to the new topic, that is the ophthalmic preparations. Now, as far as the ophthalmic is concerned, now this term is not new to you because already we had gone through the ophthalmics in our practical sessions in the last week. So where we had gone for the preparation of the eye drops and the eye ointments. So from this, basically you might have understood that all these are the preparations which are to be instilled or which are to be applied into or over onto that of the eyes, isn't it? So these are the products which are said to be the ophthalmics. There might be uh, eye drops, there might be eye ointment, there might be eye lotions, isn't it? So all these are now our discussion, our lecture that is dealing with all these ophthalmic preparations, right? So without discussing much more in a general way, let's go through the specific what these ophthalmic preparations are there, and what they are, what are their definition, what are their properties, and what are their pharmaceutical considerations, how these are going to be manufactured, and all these things. So before directly going to that one, let's have just the expectation as far as the PCI syllabus is concerned. So the PCI syllabus that will prescribe the ophthalmic preparations, which should contain the introduction, the formulation consideration, formulation of the eye drop, eye ointment, eye lotions, and the methods of preparation, labeling containers, and evaluation of the ophthalmic preparations. So all these are the topic onto which we have to discuss in next couple of slides. Of course, all these topics are difficult to cover just in one or two lecture. We require some 3 to 4 lecture in order to cover the details associated with the ophthalmic preparations. So, okay, anyway, no problem. So we will move to the ophthalmic preparations. Before directly going, what the student should know or what is the learning outcome of this. So after going through these slides, the student they should able to understand what is the ocular route, what is or how the drug absorption that will occur through the ocular route, and what are the different formulation aspects of the ocular drug delivery system. Now, in order to understand all these things, our lesson plan that will move through the introductory details associated with the ocular route, then some of the merits, benefits, and absorption from the ocular route, and the formulation aspects of the ocular drug delivery systems. So, just if we want to define that ophthalmic preparation or the ophthalmic drug delivery system or the ocular drug delivery system, what it is. So again, these are the kind of the dosage form, but these are the specialized dosage form. So they are specialized dosage forms and designed to be instilled into the external surface of the eye. So these are to be instilled onto the external surface of the eye. So these are the topical preparations. These are administered inside intraocular. These are administered or these are introduced inside of the eye. So these are said to be the intraocular or adjacent to the ocular. That means periocular. That means surrounding to that of the ocular cavity or surrounding to that of the eyeball. Ocular that is related with that of the eyeball. So just topically, we are going to be instilling onto the surface of the eye. We are introducing inside of the eye and we are introducing it surrounding to that of the eye, and are used in conjunction with the ophthalmic devices. So these require the ophthalmic devices, like say there is a dropper in order to instill the eye drops, right? Or there is a ointment which is to be introduced with the help of a device, like say the tubes or collapsible tubes, isn't it? So that is the ophthalmic devices or the ophthalmic preparations. Now, what are the different commonly used dosage forms in case of the ophthalmic preparations? So, generally, if you see very commonly, the solutions these are to be introduced into the eyes, the suspensions are going to be introduced, and very commonly it is the ointment, isn't it? In case of the conjunctivitis and all, you might have seen that there is a collapsible tube, isn't it, which is single use. Just we have to cut it at its tip, we have to compress it, so the content that will comes out and which has to be introduced into the eye. So these are very commonly used, that is the solution suspensions and the ointments. But newer dosage forms devices, if you see in case of the ophthalmics, so these are the gel forming solutions, some of the inserts which are said to be the ocular inserts, then intravitreal injections and the implants. In order to correct the eye disorders, the ocular inserts are used, like say the contact lenses and all, isn't it? In order to correct the vision disturbances or the vision disorders. So these are the newly introduced or newly designed devices that are to be used or that are to be placed into the ophthalmic. Now, if you see the ophthalmic preparations, what these are done, these are going to be instilled, a dose that is going to be instilled into the eyes, into the precorneal area, that is just before the corneal region. Now, out of these instilled dose, the drug, some of the drug that will get protein bounded and have interaction with that of the protein, some drug that will get metabolized, some drug that will get drained away, some drug that will introduce the lacrimation or will get washed out with the help of the lacrimal fluid, or sometime there is a tear formation, so along with the normal tear turnover and the formation, the drug that will goes out. So some of the drug which is to be instilled into the eye, into the precorneal area, the drug that will get protein bounded, the drug that will get metabolized, that will get drained, that will induce the lacrimation and will get washed along with the normal tears, and some of the drug that will get absorbed by the conjunctiva, by the cornea, and some of the drug or the content that will get evaporated, right? So all these are the things which are going to be happening when we are instilling something into the eye. So, and all these things are the challenging in case of the ophthalmic drug delivery systems. So, what are the ophthalmic preparations that we are going to be introducing into the eyes? So, the drugs which are used into the eye generally for the correction of the various disorders or during the process of the eye examinations, like the drug which is said to be the medriastics, which are said to be the myotics, and which are said in order to normalize the tone of the muscles of the eyes. So medriatic, these are the drugs which will causes the dilatation of the iris or the eye muscles. Myotics, these are the drug which will causes the myosis, that is nothing but the pupil which is getting constricted. So that will list, as you can see in this particular picture, this is the mydriasis, that is dilatation, and this is the meiosis, which is the constriction. Now compared to all these two, this is the normal condition. So we are introducing the drug myotics, like say pilocarpine hydrochloride, in order to produce the meiosis. We are introducing the drug mydriatic atropine in order to produce the dilatation. We are using the cyclophagics, like say the atropine, the anti-inflammatories like say corticosteroids in case of inflammatory disorders, and some of the anti-infectives like say the antibiotics and all, like say gentamicin and all, some of the antivirals and some of the antibacterial preparations. So these are very commonly used preparations. Along with this, we are also using the drugs in order to treat the glaucoma condition. That is the anti-glaucoma drugs like say pilocarpine hydrochloride, some of the adjuncts, these are nothing but the washing solutions, irrigating solutions in order to clean and wash the eyes. Then the diagnostic drugs like say the sodium fluorescent in order to diagnose, in order to detect the various disorders, and some of the anesthetics like say the tetracaine whenever one has to carry out any kind of the eye surgeries, that is the anesthetics. So before directly going to the formulation aspects of the ophthalmic products, we just understand or we should know that what is the anatomy and physiology associated with the eyes. So you can see this is the section of the eyes, and you can see the outer uh, anatomy as well as the inner anatomy. You can see the different layers of the skin. There is a white skin which is said to be the sclera, which is the outermost. The sclera is covered by the cornea. You can see this is the cornea, which is having the refractive effect. There is a iris. Iris. These are the these are the blue colored iris muscles. There is a pupil. Now this pupil that will get dilated. It will get constricted based on the light effect, subject to that of the various drugs and their effects. There is a lens. You can see the lens is there, and this lens will divide the posterior and the anterior chamber. The posterior chamber that will contain the vitreous aqueous humor. This will contain the humor. This will contain the aqueous humor, and this will contain the vitreous humor. There is a conjunctiva, there is a vitreous, there is a choroid, there is a optic nerve, there is a macula, and there is a retina. So all these are the different parts shown by the eyes, and these are normally present in case of the human being. So whatever the drug that is going to be introduced, the drug that will remain into the tear, and whatever the drug that will remain into the tear, so out of that, less than 5% of the dose that will get absorbed ocularly, and 50 to 100% drug that will get systematically absorbed. So this systemic absorption route, that is by the different routes like say the conjunctiva of the eye, nodes, and some of the minor routes like say the lacrimal drainage system. There is a pharynx, there is a gastrointestinal tract, the skin of the cheek through which the drug that will travel, or the formulation that will travel when the eyelid is closed, lips, aqueous humor, inner ocular tissues. So all these are the ways, all these are the routes through which the 50 to 100% of the drug that will get systemically absorbed. Now, the less than 5% of the drug that has the ocular absorption, so that is through the corneal route and the conjunctival or the scleral route. If you see the corneal route, it is primary route, and the small lipophilic drug they will get absorbed through the cornea. As far as the conjunctival route is concerned or the scleral route is concerned, the larger hydrophilic drug they will get absorbed through the conjunctiva. So this you need to keep in your mind. The corneal route that will permit the lipophilic drug to get absorbed and the small molecular weight, whereas the conjunctival route that is with the large hydrophilic drug. So in case of the corneal route, there is a aqueous humor, then there is a aqueous tissue where this drug that will goes through the conjunctival and through the corneal route, right? Now, if we see the anatomy, as I said, that there is a sclera, which is the outermost and the protective layer, and that is responsible for offering shape to that of the eye. Then there is a cornea, the cornea that will form the front part of the sclera, and it will allows the light to enter. The cornea that will possess the refracting surface, and this refracting surface that is responsible for the focusing power. There is a choroid. So choroid, that is the second layer which lies between the sclera and the retina. The blood vessels that will provide the nourishment to the outer layer of the retina. There is iris that will give color to the muscular tissue and which will respond to that of the surrounding light. The lens that is the transparent and the biconvex, which will refract and will focus the light onto the retina so that the vision that will occur or the object that can be viewed. Then there is a retina. So retina, that is the innermost layer which will convert the images into the electrical impulses, and through the retina the images or the impulses that are generated into the electric impulses that will be sent to the brain along with the optic nerve so that the image that can be interpreted by the brain. Then there is a macula that is nothing but the dark spot you are going to see onto the back of the eye, that is responsible for the sharpest vision. If you see the eyeball that will having the two different section, larger section that is to the back, which will contain the colorless gelatinous mass called the vitreous humor, and there is a smaller section that is the front section, which is the clear water-like material, which is called aqueous humor. So this is what is I was talking about, the lens that will divide the eye into the two different chamber or the two different section. The back section to that of the lens, that is the section which will contain the vitreous humor, that is the colorless gelatinous mass that is responsible for the shape of the eye. And in front of the lens there is a smaller section which is the aqueous humor and which is the clear water like material. Then there is a conjunctiva. Conjunctiva is a mucous membrane that will lubricate the eye during the process of the closing of the eyelid. Now, in order to absorb the drug into the eye, there are various factors which will affect the availability of the drug. And that the very first factor, that is the rapid solution drainage by the gravity, which is induced by the lacrimation due to the blinking reflex and the normal tear turnover. So we could not able to keep our eyes open for a longer period of time, just more than few seconds, right? So we have to go for closing the eyelids, and during the process of closing of the eyelid, the uh, dosage form or the eye solution or the eye drop or the material which is introduced, that will get washed out. Also, the anatomy, if you see, we are standing into the upright position, so there is a gravity, and when anything that will get introduced into the eye, that will lead to that of the process of the lacrimation and the process of the tear formation. So along with this lacrimation and the tear, the drug or the dosage form that will get washed out. Then the normal volume of the tear, that is equal to 7 microliter, and the blinking eye that can accommodate a volume of up to 30 microliter without spillage, and the drop volume, that is the 50 microliter. So this is the difference, that the small drop even which will contain the very large proportion of the drug, that is 50 microliter, but the normal volume of tear, that is the 7 microliter, and the blinking eye that can accommodate up to 30 microliter. So it is only the 7 microliter which is directly coming in contact, whereas the remaining that will get waste. So this is the pictorial representation where you can see that how the lacrimal drainage that will occur. You can see there is a eye, and just at the corner of the eyes you will going to find some openings that is said to be the punctum, and then there is a common canaliculi. This is the anterior, and these two, they will come from the top and the bottom. They will unite at a place that is said to be the common canaliculi. There is a lacrimal sac which is responsible for generation of the lacrimal fluid. There is a canaliculus, lacrimal sac, that is of 12 to 15 millimeter, canaliculus that is 8 to 10 millimeter. There is a nasolacrimal duct, because this lacrimal duct, it will comes and it will opens into the nose. So there is a anterior lacrimal crest, and you will going to find that it will open into the nose. So whatever the drug or the solution which is introduced into the eye, it will passes or it will travels its journey through this nasolacrimal duct, and it will appears into the nose. So if you see the absorption, there is a low corneal permeability for the drug because of the lipid barrier, which will act as a lipid barrier, and the transport of the hydrophilic and the macromolecular drug that will occur through the scleral route. So the hydrophilic drug that cannot be absorbed through the cornea, but it will get absorbed through the sclera. The lipophilic agents of the low molecular weight, they will follow the transcorneal transport by the passive diffusion and will obey the Fick's law. So you can see the lipophilic drug, they will get absorbed through the cornea, whereas the hydrophilic drug, they will get absorbed through the sclera. So there is a Fick's law. What the Fick's law is? Fick's law, that is the J equal to minus D multiplied by small d capital C M divided by dx, where J is the flux, that is the rate across the membrane. D is the diffusion coefficient, the diffusion coefficient that will increases as the molecular size of the drug that will get decreases, and there is a concentration gradient Cm. Cm, that is the concentration gradient. As the drug solubility that will get increases, the gradient will also get increases, and this is the driving force for the drug entry into the aqueous humor also. So there is a need to have the more drug solubility in order to increase the gradient and in order to increase the entry of the drug into the aqueous humor. So there are some of the challenges, like say the in case of the corneal absorption, and because of which there is a poor bioavailability. Now the first challenge, that is the protective mechanism and the anatomy of the eye, that is the second challenge. So the protective mechanism, like say the blinking, during the process of blinking, the contact that will get reduced between the solution or the drug and the eye. There is a reflex lacrimation and there is a nasolacrimal drainage. If you see the anatomy, the barrier properties of the cornea, which is cornea that is highly impermeable to the most of the content. So that is one of the barrier, and all these are the challenges when we are going for formulating anything that is through the that is by the particular ophthalmic route. So with this, today we will stop at this particular point only.